Now, governors have expressed concerns on some proposals contained in the Digital Health and Facility Improvement Financing Bill. The county bosses, in a meeting with Ministry of Health officials, argued sections of the bill duplicate legislation already approved by county assemblies. Our reporter Abdiaziz Hashim has the details of the meeting as the government seeks to build support for 4 health-related bills expected to bring far-reaching reforms in the health sector.
The Ministry of Health officials, led by Health Cabinet Secretary Susan Nakhumicha, held a meeting with the Council of Governors to discuss proposals contained in 4 health-related bills approved by the Cabinet.
Matters of implementing whatever is going to be in the bill, we will go to the second level, which is regulations. Regulations are the one that then prescribe the manner in which the bills will be implemented. So we have a long way to go.
The Council of Governors expressed reservations on sections of the Digital Health Bill and Facility Improvement Financing Bill.
If you say that the ministry will be the custodian and the counties would have to seek the permission of the ministry to access data that corresponds to or relates to a specific county, that can be of great challenge to us.
That we shall provide in the regulations levels of access. So that if Governor Mudomi, you need access to the data of Tharaka Nithi, then you have it. But you have no access to the data of Kirinyaga County.
30 counties already passed a similar bill. The governors argued sections of the bill already overlap approved bills in the same counties.
So we'll be seeking to know exactly where do we place the bills that have been passed by the counties, resources have been used, and these bills have been customized to ensure that every unique need of the county has been taken care of in this FIR bill.
That it doesn't harm anything for us to have the national framework, policy framework on the FIF. It doesn't harm. Then you can have the individual county descriptive frameworks in terms of what, but we'll provide the big one, the broad-based one, that then those can borrow into.
Health Cabinet Secretary Susan Nakhumicha, however, assured the county bosses that the 2 levels of government will work together to harmonize any areas of concern.
If you give me a bill or an act to employ 1,695 workers who are CHPs, I cannot do it because of the resources.
On CHPs, even at the national level, we agreed that they are not workers. And that is the reason why we did not call them community health workers, because it was the easier way to call them and not volunteers. That's how we settled on promoters. So the issues in terms of them being part of the wage bill, that we are cognizant of it.
The 4 bills, the Primary Healthcare Bill, Digital Health Bill, Facility Improvement Financing Bill, and Social Health Insurance Bill 2023, are expected to be debated in Parliament. 2 of the bills, namely the Social Health Insurance Bill and Digital Health Bill, will be tabled next week in the National Assembly during a special sitting. The 4 bills, if approved, will effectively result in the dissolution of the National Health Insurance Fund (NHIF). The Council of Governors and the Ministry of Health have tasked technical committees that have been appointed by both sides to come up with a report that they will later table before the Council of Governors and the Ministry of Health ahead of the Mashujaa Day celebration, where the universal healthcare coverage will be launched. Abdiaziz Hashim for Prime Edition.